So thanks for joining tonight. My name's Chris. I'm the lead for the Sleep Practitioner program. I'm going to take you through an overview of the program and answer any questions you may have. What I'll do is I'll start off looking at the school, just in case you don't know who we are. Then I'll talk about being a sleep practitioner. I'll talk about the program and also the course structure and content, and I'll finish off with some practicalities. Okay, so about the school. So we run a number of different courses, and so we've got these grouped as foundation courses, workshops, essentials, and the expert seminars. The foundation courses are the larger qualifications, full qualifications like the sleep practitioner program. We also do the maternity nurse program, early years educator, home-based childcare with child mindful professional nanny routes, and also neuroscience for early years practitioners. And so these are accredited by either NCFE Cash or OCN, and so they come with assessments, and they're kind of as our larger courses. To accompany those and also to help develop our childcare professionals, we run CPD type courses or workshops, and these generally fall into the categories of either behaviour, nutrition, or child development. And also what we run is a regular startup hub, which is a multi-week series where we talk all about entrepreneurship and setting up and building your business. Beyond that, we've got our essential courses. So these include the Common Core Skills and Knowledge course and also Pediatric First Aid. So these are things that you might need for your job role. And then finally, we've got the expert seminars. And so we regularly invite experts to talk about something novel or topical in the childcare industry. And they're sort of 45 minutes to an hour long. And that forms our expert seminar series. And it's not just about individual students. We also have organizations who use us as well. So here's just a handful. We've got various organizations that we work with to provide training to them as well. Okay, so being a sleep practitioner, let's start off with just considering what a sleep practitioner is. So a sleep practitioner is someone who's able to look at a family setting, identify the causes of sleep issues, develop a plan to address the causes, and empower parents to continue with that good practice. And so to be a good sleep practitioner, we feel there's certain characteristics, traits, and skills that are beneficial. So in terms of those skills, knowledge is obviously important, so an extensive understanding of sleep, being able to diagnose, so assessing an individual's sleep issues, problem solving, so developing solutions to problematic sleep, and communication is quite vital. So when you're working with clients, translating what could be complex information in a clear and concise way. And to accompany that, the kind of skills that are beneficial, so interpersonal, obviously communication, that's very important. Working with clients, it's important to use the appropriate tact and empathy that's required. And you need to be a self-starter, because if you're going to be an independent consultant as a sleep practitioner, you're not working for someone else. No one's telling you what to do, so you need to be resilient and be able to work out what you're going to do, what you're not going to do, and actually do it. So that self-starting is quite important. It goes with resilience, but resilience also couples with this kind of adaptability to change or to setbacks. Not everything's going to go as smoothly as you might want, so you need to be resilient to that, and things may change. So that adaptability is important as well. Networking is really important. So in terms of clients, through word of mouth and those kind of routes, you can build a network of potential clients and past clients, and that's a really good way of getting business. A peer networking group is also very useful. So other sleep practitioners and consultants who you can work with, bounce ideas off, troubleshoot, those kind of things, hugely useful. And also, as a sleep practitioner, your expertise will be about sleep practice, but quite often you'll have to use other health professionals when something goes beyond what you're expert in. And so it could be medical practitioners, so GPs, could be occupational therapy, those kind of things. And it's really good to build that network of other professionals as well. And finally, we've got reflection, which is important in all aspects of life and all kind of careers. But in terms of that continual professional development, look back on what you've done. Did it go well? Did it go badly? What could have gone better? How could you have handled it in a different way? Be aware of those kind of strengths and weaknesses that are kind of becoming apparent, and work towards them. Okay, so those are kind of an overview of sleep practitioner. What other considerations should we think about? So I talked about self-starting and resilience. So being self-employed, it does require a certain attitude. So to many people, it's very rewarding and a kind of chosen path, but you do need to be aware that working for yourself can be challenging. So there's certain things that go beyond just doing the actual work. So getting work is obviously a big part of it. You need to market yourself, you need to sell yourself, get clients. That is something that you will need to do. There's also company admin, so just general things, HMRC obligations, doing your tax returns, those kind of things that they need to be done. And also money management. So you don't get a salary as per se. You will get income, you will have expenses. You will need to make sure that it's a profitable business, and you'll need to make sure you've got money set aside for any outgoing expenses that you know of in the future. So there's all these different aspects of money management. But outside of that, this kind of course is still very rewarding to many. The other thing you kind of just need to be aware of is that as a sleep practitioner, every situation is unique. Parents can see things differently, be under different levels of stress. Children are all different, they're all unique. And as well as that, in family settings, you've got cultural differences between families. So all these things mean that pretty much every situation you'll face is going to be a unique situation. Now, to many, this is a kind of a positive, because it makes the work really interesting. You're always experiencing different things, and you're learning from new experiences. Ultimately, in terms of addressing sleep issues, regardless of these unique situations, you've still got the same principles underneath that you can use to basically provide support and hopefully provide solutions to issues. I've mentioned a couple of times it's still a rewarding career to many. There was this survey that was produced not long ago, and one of the questions was, what do you find most rewarding about sleep coaching? And so here are some of the responses. I faced sleep challenges with my first child, and the ability to help others avoid or correct similar problems is extremely rewarding. Building relationships and supporting families. I feel like I'm saving families. I have to watch parents become more empowered, better rested, happier. I love that I'm helping children get the rest and loving care they deserve. I love this work. I love working with families, and I'm passionate about sleep. I love having my own business and controlling my work life. And then finally, happy parents. How the parents tell me over and over again how they have their life back, how they can finally work and be themselves and have a relationship with their spouses, bringing back sleep and rest and peacefulness in their house. I love it. So there you go. So what about the industry itself? It's still seen as a growing market. So McKinsey reported on it in their report a couple of years ago, but the overall sleep health economy is growing with little sign of slowing. It's certainly, in my mind, sleep practice, so sleep consultancy, it seems to be just the notion of sleep is becoming more mainstream. So in the past, in terms of kind of the health sphere, diet and exercise were the two key elements that could help your lifestyle in terms of good health. And now sleep is being seen as now one of the three. So it's really becoming very mainstream. On top of that, with child sleep, parents are really realizing the value of using sleep practitioners to resolve sleep issues early on, as they see a lot of benefit in getting that resolution. In terms of kind of compensation for sleep practice, one of the advantages of going into this practice is you can set your own rules, you can set what you offer and how much you charge. Useful to understand what others charge to kind of, you're always going to have some kind of competition. So understanding what others are charging is really useful. And quite often the offers are based in terms of packages, and there'll be kind of sort of cheaper packages, a bit more expensive packages. But here's a table of just a few I found when I was kind of searching for sleep consultants. You can see that the price is the kind of cheapest is £30 for just an email consultation, going around about the kind of £100 mark for phone consultation, and then going up into the few hundreds for some kind of package, up to as much as 3,500 for kind of a very comprehensive several week on-site package with onward support and that kind of thing. So there's many options that you can follow. Okay, so let's talk about the program itself. What are we trying to do? We're trying to prepare students for a career as an independent sleep practitioner. How do we go about it? So these four kind of quadrants, we've got knowledge, so basic sleep physiology, what does healthy sleep look like, how to promote good sleep, detrimental sleep factors, and sleep techniques. Then we've got diagnosis. So this is all about how to assess a situation, what kind of tools are available to use, and what kind of considerations need to be made. The strategy is about producing a plan to move from current to improved. And as part of that, educating parents in right approaches. It's quite often parents that are going to make some of these actions and implement some of your recommendations. And then finally, we've got employability. So it's very important because without work, then you can't put your good skills and knowledge to use. So employability, working as an independent consultant, and all the different aspects of marketing. Right, so if we look at the course itself, we split these up into these different components. So we have live sessions. These are 2 to 3 hours long of live sessions. Actually, I'll go through the details of each of these in a minute. So we've got live sessions, we've got e-learning, we've got the assignments, and we've got our support groups. So live sessions, weekly basis, as I said, about two to 3 hours, maybe 1.5 to 3 hours long. And they're very much interactive. We deliver them virtually, just like this session. But we do it as a cohort. So we have a class of people and they all progress through the course together. And we find that's quite beneficial for your learning experience. So because you're all learning at the same rate and you're at the same stage in terms of your learning, you're able to work with each other and off each other to help each other out and help in your learning that way. We follow a kind of structured approach, so we follow the learning in a way to build on your knowledge sequentially. And I think I talked about the appropriate duration. So yeah, so that's those are the live sessions. To accompany that, we've got the e-learning platform, so you'll have access to our portal. In there, there's loads and loads of supporting information. So lots of resources. You've got slide handouts for the live sessions, useful links and downloads, recordings and videos. So all the live sessions are recorded, and in your portal you'll find the recordings. So you can always go back and revisit a session, or if you miss a session, you can always go and watch the recording afterwards. There's also references that are used throughout the course, and also recommendations about some of the books that we find useful. On top of that, we'll also add some additional content. So this is offline content that we find is useful, either necessary, and we'll signpost you to that as part of the course, or kind of additional that we find might be of use. So we'll mention those within live sessions as well. Okay, there's a set of assignments that you need to complete and pass as part of the course. So these cover this list. So there's some sleep plans, some case scenario analysis, some short questions. You need to provide a leaflet about SIDS. You'll need to produce a poster about how diet and activity affect sleep. There'll be an essay questions about sleep techniques, and then on top of that, there's also a oral assessment, which is we call a Viva, and so that goes through some of the questions and also signposts you to maybe areas where you should continue to look in terms of further development. So these assignments, they're not just there to assess you. We kind of designed them to build on your knowledge and prepare you for practice. So by doing those, you're doing some of the things that you might need to do as a sleep consultant. So it's kind of doing them in a kind of safe space and getting feedback on them. And some of the things like the leaflets and the posters, these are kind of assets that you can use and give out to clients once you're practicing. So certainly not throwaway work. You can actually use those as you start moving forward. The time frames, there's 10 weekly sessions. After the final live session, you then have a further 6 weeks to complete your assessments, hand them in. But we are aware that everyone's got their own personal circumstances and unexpected things do come in. If you think you're going to struggle to meet that deadline, come and talk to us. You know, we're quite flexible. So if you've got valid reasoning, then we can provide extensions. And throughout the whole process, you've got us to support you. All the trainers are available to help you through this process. Finally, we've got the support groups. So we've got 2 formats. We've got the cohort-based WhatsApp group. So this is purely for your cohort and the trainers. So it's kind of a more immediate, small, focused support group in terms of the course itself as you go through the course. And then for all our past students, all the graduates and the current students, we've got a wider Facebook group, and that's a great place to ask for advice and troubleshoot things and just maybe soundboard your approach to make sure that you're on the right lines, that kind of thing. It's generally a very supportive group. So both graduates and trainers all chip in terms of providing advice, and it's a nice, friendly, supportive forum. Okay, so we're going to move on to a bit about the course content. So going through the actual taught content chapters, there are 8 of these, and these are the titles. The sleep practitioner, physiology of sleep, healthy sleep and supporting sleep, conditions preventing healthy sleep, sleep techniques, strategies, special cases, and employability. Going through those in a bit more detail. So we start off with the sleep practitioner. So what is a sleep practitioner? And looking at some of the challenges facing a sleep practitioner. That involves some of the challenges of working with parents, understanding child temperament and how different temperaments can be manifested in different children. And then similarly, family dynamics and culture, how that can differ and consider in that space. And also understanding child development. So understanding what normal looks like is really important, especially when faced with a particular scenario. Chapter 2 is all about physiology of sleep. It's the most kind of biological part of the course. So looking at what sleep is, why we need it. Sleep regulation, which is a main part of this chapter, so understanding those 2 different mechanisms, the 2-process model. And also looking at sleep architecture, so the different stages and cycles within sleep. Chapter 3 looks at healthy sleep and supporting sleep. Understanding nap times and sleep times, what kind of causes and effects there are of lack of sleep. And then what do we do to support sleep? Looking at kind of that sleep hygiene and sleep routines, feeding, physical activity, environment, swaddling and baby wearing, and also objects. And also as part of this chapter, we also look at SIDS. Then there's conditions preventing healthy sleep. So these focus on the 4 areas of either short-term illness, feeding issues, anxieties and bedtime resistance or sleep disorders. Within sleep disorders, we'll cover some of the more common disorders, but obviously it's more a clinical side of things, but it's important to be at least aware of some of the disorders and kind of the next steps in terms of what you would do in faced with those kind of disorders. And we move on to sleep techniques. So these are techniques that may or may not be beneficial in certain cases, but here we teach what they are, what kind of considerations we need to do. For instance, there are things that we would need to consider around attachment and sleep hygiene and those kind of things, which would mean whether the child is ready to implement a technique or not. And then when we look at techniques, newborns are different. So we look at newborns separately. And then for the techniques, we move from the kind of hardship crying techniques through the fading techniques of no cry. And we also look at what can be used for older children as well. Chapter 6, we look at how we put everything together. So data gathering through to assessment and then creating a solution. That leads to putting together a plan, and then we implement. So that kind of 5-step process to, once we have all the information, ultimately ending up with a plan that we implement with the family. Part of this is we go through some case studies to see how we put that into practice. And then we've got chapter 7, which is special cases. So we look at how we do things differently in certain special cases such as these, so premature babies, neurodivergence, ADHD, low tone, communication challenges, physical disabilities, and also with twins and multiples. And finally, we've got the employability chapter 8. So this goes through the planning side. So what we would do as we were gearing up to becoming a sleep practitioner. The setting up is actually setting up as a self-employed, registering with HMRC and tax and NI obligations. And then the sort of the big part of this chapter is all about developing your business. So marketing, developing your brand, having an online presence, the benefit of complimentary consultations and how to do those. And obviously social media, that's something that's in our the age we live in, we're dominated by social media, and so how can we effectively use social media? So those are the 8 chapters of talk content. Then weeks 9 and 10, we use those as group study sessions. So these are opportunities not only to ask questions and go through any kind of recaps you want, but also to work through case studies of real life examples. What would you do? What kind of red flags there are? The next step in terms of using your knowledge in terms of how you would actually put that into practice. And so we try and use these to bridge the gap between student and practitioner. And here I've got I've got just a few minute clip of one of these sessions so that you get a sense of what they're about.
Okay, case study 3, 18-month-old boy, multiple night wakings, co-sleeping as a result. Goal is for him to sleep through the night in his own cot, not need parents, to support him to fall back to sleep. So he's waking 6 to 7. What time is bedtime? 7 to 7:30. Okay, so that's balanced. Nap 1.5 to 2 hours. 18 months. I'd be capping it at 90 minutes ish. Bedtime, going to sleep isn't a problem. Falls asleep independently after a good bedtime routine. Sleep latency 20 minutes. Okay, that's interesting. Then wakes up moaning, moving eyes open at around midnight. Okay, so that is a transitional waking. That's good news. Sometimes at about 10. Right, do you remember hypnogram around 10, 3 hours after they go to sleep, which is 7, 7:30. There we go, 7, 8, 9, 10. There's your 3 hours. And then midnight, 5 hours later. Perfect. So we know those are behavioral transitional stages. Sometimes we see this, the moaning, groaning, eyes moving. They're actually transitioning cycles, not waking. And the parents are dart in there quickly to stop them waking, and in fact inadvertently do wake them up. So that's always worth waiting, holding back. If in doubt, hold back again. just wait for them to transition those stages. What are your thoughts?
Would it be useful for him to have the same time waking every day? Because between 6 and 7, it's quite a big,
yeah,
isn't it? So like if she was to wake him at 6:30 every day, then his cycle would start, and then his naps might be a little bit more predictable, and then bedtime as well. Yeah,
good point. Good point. Thanks for that.
Also, she wants a gentle approach, maybe keeping him in his cot, but if she feels comfortable with it, getting a blow up bed or something, or the partner and kind of popping it in the bedroom, and then
perfect
that way if she wanted a more gentle approach.
Excellent, thanks for that. Yeah.
Okay, so hopefully that gives you a kind of an idea of the kind of discussion we have in those group study sessions, which I think are really useful. And you heard there Roseanne, so these are our teachers on the program. Roseanne is there, as you just heard. So she's a pediatric nurse and a sleep practitioner of many, many years, about 30 years now. She's also heavily involved in the International Association for Child Sleep Consultants. Next, we have Julie. She's an area specialist and a sleep practitioner of similar years, 20, 30 years, and also been a maternity nurse practitioner for many years as well. You've got myself in the middle, so I'm a biologist and a nutritionist, and I take the sleep physiology chapter. Anna comes from a clinical background, so she was a sleep physiologist for many years. More recently, she was working at Evelina, the children's sleep clinic at Guy's Hospital. She's more recently a sleep practitioner as well. And then finally, we've got Lorna, who comes from a primary school teaching background, but has been a childminder for quite a number of years as well. And then more recently has gone into entrepreneurship, runs an award-winning business as well. And so she brings together the both childcare industry and how to run a business and takes the employability part. Right, I can see Veronica has a question. Yeah, it's gone down. Maybe that was a mistake. If you do have questions, feel free to write in the chat. Otherwise, we'll pick up some questions at the end. Okay, so what do you get as part of the program? We've got those 10 live sessions, 8 sessions of talk content, 2 group study sessions. You get access to the e-learning portal. You've got plenty of support, so training and support throughout your course, but then also after the course, we're still happy to help you, and we'll do that. We'll continue the WhatsApp group for a bit, and then move you on to the Facebook group, so you'll still have plenty of support as you're in your early careers transition. We feel very confident about the program, and so you've got 28 days from the start of the course. If you feel it's not for you, reach out to us, and you've got that money back guarantee. But then on top of that, you also get this free reflux workshop. So we run on a regular basis reflux, colic, and food sensitivities workshop, run by our pediatric dietitian, and that delves into much more detail about those elements, so reflux, colic, and food sensitivities, quite often how they get misdiagnosed between each other, and it's a really good complement to the sleep program as well. As well as that, we run our expert seminars, so these are the expert-led topical seminars that we run on a regular basis. You'll have free access to those as well. And also we run our startup hub. So this is a kind of an entrepreneurial multi-week program where we help you in terms of starting up and all aspects of business. So you're welcome to join that as well. Why should you choose us? So we've been here for quite a number of years, over 10 years now running. So we're quite established. We're a very recognized training provider. We're very student-centric, so it's our goal for you to succeed. So we're not just about putting you through a course and sending you on your way. We actually do want you to make a success of your life. So we're there for you, and we want to support you. We've got lots of experts on hand, so we're quite proud of all the expertise within the business. and we make that available to you. We follow a holistic approach, so there's no, we don't sort of lurch onto just one aspect. When we teach sleep practice, it's very important to look at the whole picture, take in all the data you can, because there's lots of variables, and you really need to take a holistic approach when you do sleep practice. In the same way, when we run our programs, we kind of follow that same approach as well. Evidence-based, so we rely on research when we're putting together our courses, and so that's very much the same with the sleep program. And we also don't stop at once we've produced a course. We do keep looking at what new research is coming up, and we keep revising, and so in that way the course is dynamic. Other than that, we're flexible, supportive, and competitive. We think we quite adapt to student needs and help them where we can. We feel we're priced to give maximum value in terms of what we offer, and we've got a lot of success stories in terms of our past graduates. And so here's just a few of the recent graduates who have gone on to set up successful sleep consultancies. I think there's quite a few more than this since I put this slide together, but it just goes to show that we're getting a lot of successful sleep practitioners who are not only graduating, but actually going on to make successful consultancies themselves. And where our students come from, so various backgrounds and ages. In terms of why they come to us, obviously a big factor is because they want to become sleep practitioners. It's not the only reason. Some people want to just help with their own children or even grandchildren. We had a grandma who was coming to learn more about sleep so she could help her children with her grandchildren, if that makes sense. And also we've got other kind of healthcare professionals, GPs. They obviously work with patients, some are pediatrics, so work with children, and sleep is becoming more of a big thing. It doesn't get taught enough in medicine, so they come to us to get that kind of specialist sleep knowledge. Similarly, nannies, maternity nurses, and other early years workers, they may want to enhance their offering by having that sleep knowledge and skill set that goes along with what they offer. And in terms of where they come from, the students, so all over the UK and often from abroad. So here's a little word cloud of some of the countries that we have graduates from. So you can see quite a few from Europe, Italy, Spain, Ireland, Portugal, Slovenia, but also further afield. So we've got Hong Kong, we've got Sri Lanka, what else have we got? Armenia, Argentina. So yeah, so we've got quite a wide reach in terms of where our students come from. Okay, practicalities, final slide. So we run 6 cohorts a year. We've got 2 left this year. They run either on Thursday evenings or on Saturday mornings. So the next one is starting on September 5th, which is going to be a Thursday cohort, so every Thursday at 7 p.m. And then the final one this year is going to be October 26th, which is going to run on Saturdays at 10 a.m. Full fee is £1,680. If you book ahead, a month or more ahead, then you only need to pay a £300 deposit and then pay the balance 2 weeks before. And if you book a month ahead, you'll get an £85 discount as well. You can also pay by instalments. So you pay monthly, 12 monthly payments. So you pay £140 initially and then followed by 11 further payments of £140. And that's also £1,680.